We're going to go ahead and get started with the medical disclaimer. The information provided is for educational purposes and is not intended as medical advice or a substitute for medical advice of a physician or other qualified healthcare professional. We do not aim to diagnose, treat, cure, or prevent any illness or disease, and you should always consult with a doctor or other medical healthcare professional for advice, information regarding diagnosis and treatment. And of course, this information has not been presented or evaluated by the FDA or any other medical body. So good morning, good afternoon, good evening, wherever you are in the world. This is Dr. Dori Narbo. I'm your host on today's call. And I am, for those of you who don't know me, I'm a clinical researcher and an author of several books. Okay, click, yeah. Well, welcome to our Tuesday call with Clayton Thomas, who is the founder of Root. And Clayton has over 25 years of experience in the health and wellness industry. And for the past 16 years, he's been focused on detoxification and supplementation formulations. A simple philosophy, cure the cause. And hello, Clayton, and welcome to the call.
Happy Tuesday. And may it be as good as last week.
Well, that's going to be hard to top. Well, welcome to the call. And today we're going to talk about fertility. I thought you'd like this topic. Just to let you guys know, we have a special guest speaker that's going to help us with this topic. But first, I'm going to go ahead and recap our talk from last week.
If you pulled Dr. Ruth, I'm going to be amazed.
Yeah, that would be amazing. I would be amazed too. Okay, so last week was Testimonial Tuesday with 3 amazing women and Sandy, of course. So it was heartfelt, authentic as they all shared their deeply moving experiences. And one thing that really stood out was that each one used very few drops in a relatively short amount of time to have outstanding outcomes. And for those of you who missed that call, I recommend that you go to the Root Band's YouTube channel and listen to the calls. And they were all broken out into different segments. So, you know, there's the master video, and then there's each one has their own video. So I really suggest that you take a look at that, because these are really authentic, heartfelt testimonials, and they're extremely moving. Well, concerning fertility and infertility, it's important, first of all, to understand the difference between the two. The word fertility means the ability to produce, and deciding whether or not to have children affects fertility rates in countries. And the word infertility means the inability to conceive children. And on many calls, Clayton, you've talked about declining fertility rates. And since the 1950s, the total global fertility rate has dropped by half, according to the Lancet Comprehensive Global Burden and Disease Study. And the fertility rates have been falling steadily since 2008 and has really never returned to the peak record in 1958. So this trend in most countries is due to education, women entering the workforce, contraception, social status, and mortality rates. And I think I told you on because we actually had a fertility call back in the beginning, like last year. And I told you that I was actually doing some genealogy work on Kurt, and found out that in 1810 was like 4.5. And when I was doing the genealogy for Kurt, and going back, you know, into the 1800s, they were having children. His family was having children, like 8 to 10 was the norm. And then back in World War II, the rates dropped to 1.88 and then peaked back up in the 70s to 2.9. And today we see an all-time low of 1.66. And that's not just in Norway. We're seeing this globally, this whole worldwide. So now we're going to talk about infertility, which is really interesting, because according to numerous studies, more women who eventually get pregnant have problems conceiving and carrying a child to term. And today, as many as 1 in 7 couples trying to have a baby will experience infertility. In fact, recent studies show that After a year of having unprotected sex, 15% of couples are unable to conceive a child, and after 2 years, 10% of couples had still not achieved a successful pregnancy. So that's dramatically different than what was, for example, 20 or 30 years ago. So, and by 2025, almost 10 million couples will encounter a problem conceiving a child or even having a baby. So it has nothing to do with sperm counts or the usual things that come to mind when discussing fertility. Instead, it's being driven by women in education and work, greater access to contraception, and basically women choosing not to basically have fewer children. And they're basically delaying having families. And with the passing years, of course, this increases, well, guess what? Environmental toxins. Your exposure to environmental toxins goes up every year you delay. And other factors include a direct correlation between autism and parents' age. And researchers found the spectrum disorder prevalence is 66% higher in children born to fathers age 50 and older, and 28% higher in children born to fathers in their 40s and those in their 20s. And of course, we're not blaming the fathers, but maternal age increases the risk of gestational diabetes and miscarriage as well. So this is a world map percentage of fertility cases per region that are due to male factors. And this figure demonstrates rates of infertility cases in each region. And you can see where the regions are most affected here.
But Down syndrome is, one of those factors that increases risk with age, but the science shows that it's mercury toxicity in the womb that actually causes the damage to the chromosomes early on in development that creates Down syndrome. So
that's a really new and emerging subject. And today we're going to cover age, ovulation, endometriosis, polycystic ovary syndrome, pelvic inflammatory disease, premature ovarian failure, thyroid and the fertility connection, gut health and dysbiosis, semen and sperm, ejaculation disorders, male hypogonadism, lifestyle, vaginal microbiota, vitamin deficiencies, erectile dysfunction, EMFs, glyphosates, heavy metals, toxins, endocrine disruptors, and much, much more. So, and to help us with this topic, we have our special guest speaker. Are you ready?
Yeah, of course I'm ready. Tina!
We have Dr. Tina. I'm not even gonna, I tried to pronounce the name for like 2 days. Okay, I'm calling her, it's Dr. Christmas. Did you know that her name directly translated means Christmas? So Dr. Tina Christmas. Okay.
Bozichnik.
Yeah, thank you. She's one of the most trusted names in childcare in Slovenia today and trusted worldwide. She was voted Pediatrician of the Year for 2 consecutive years in 2019 and 2020 in Slovenia. She's a holistic pediatrician, functional medicine doctor, acupuncturist, and not only is she a pediatrician, but she also treats the entire family. And in 2019, she created an online summit called Parent Like a Pro, interviewing the world's most renowned experts on parenting and personal development, launching her as a global leader and a go-to holistic doctor, transforming the lives of families worldwide. Dr. Tina is a highly dedicated doctor with a passion for unwavering love for children's well-being, which drives her never-ending quest for excellence. She has a special connection with children and practices personalized medicine, focusing on curing the cause instead of treating the symptoms. She creates a space using a heart-centered approach for both child and parent to achieve optimal health and a beautiful relationship. In addition, Dr. Tina serves on the Scientific Advisory Board for ISNS, which is the International Science and Nutrition Society. ISNS is a global research group with a team of dedicated scientists and medical doctors working with innovative, cutting-edge technology, research, science, and nutrition. ISNS will provide third-party research such as abstracts, case studies, and posters for the Root brand products. So welcome to the call, Dr. Tina. Hey, hello, welcome to the call. You have a lot of stuff to go over. I'm so glad that you agreed to come on the call because you are such a wealth of knowledge.
Thank you so much for having me.
You're welcome. So first, we're going to talk about age, and the risk of miscarriage increases strongly with maternal age. And a woman's fertility peaks in her early mid-20s and starts to decline once you reach around the mid-30s. And by 45, fertility has declined so much that getting pregnant naturally is unlikely to occur for most women. And it was really interesting because Norwegian researchers studied age-related miscarriages. They studied 421,201 pregnancies during this particular time period. And what they found was that pregnancies that ended in miscarriage were lowest among women between 25 and 29 years old, increased sharply after 30 years, and 53% of the pregnancies among women 45 or older ended in miscarriage. So there was a strong repeat risk for miscarriage. And also, how does the age affect a woman's eggs? Well, the number of eggs decreases as a woman gets older. Also, the remaining eggs in older women are more likely to have abnormal chromosomes. And as a woman ages, they're at higher risk for disorders that can affect fertility, such as uterine fibroids and, of course, endometriosis. Do you have any comments about that, Tina?
Yeah, I was just thinking now that you were talking about miscarriages, and it's not maybe just with age related, but as a functional medicine doctor, I always think of what we can do and some things, and I know you're gonna get to that, is we need to look at always finding the cause, and it could be so many things, especially with miscarriages. We need to look at progesterone, what's going on with the progesterone levels, which tend to be very low, and then autoimmunity, gut health, nutritional status, methylation activity, toxins. So it's not just the age, because I've seen so many older women who got pregnant spontaneously, even after being in their 40s, and they were pregnant for the first time, and nothing happened negatively. I mean, the pregnancy and everything went fine. So what is the cause besides the age and everything? So it's always, we have to take everything into account. You were mentioning toxins, stress, like all those things. But a lot of times what is missing, what I see is, especially in pregnancy, is that the progesterone levels are in check, and what's going on with the progesterone, especially if we have a history of irregular periods from the beginning, from when they start. And then what typically is happening, a young girl, a teen still, is put on the pill, and then the periods get regular. Now she's in her 30s, she wants to get pregnant, gets off the pill. What happens? The periods are irregular again, and then we have like IVF coming up.
Okay, so now we're going to talk about insulin resistance. So researchers have found that women and men with elevated blood sugar and insulin resistance are at greater risk for fertility challenges. And in women, two common conditions that may result in insulin resistance is PCOS, known as polycystic ovaries, and obesity. And someone with PCOS may be obese, which can intensify the symptoms of PCOS. And some women may also be obese, having insulin resistance without having PCOS. And women with PCOS or obesity, or both, sometimes they'll have both problems, and commonly, have problems with ovulation.
Well, and the primary cause of insulin resistance is heavy metals and environmental toxicity.
We have to, especially when we're talking about insulin resistance, like, do you know what's one of the fastest ways you can kind of determine if someone has insulin resistance, not doing any lab work?
Besides looking at body type and lifestyle?
I mean, yeah, body type, you're close. So what about body type?
Well, for me, it's usually the abdomen.
Yeah.
But what's that?
What about the abdomen?
Well, excess belly fat, or additional belly fat.
So one of the things that if people are and patients are coming to see me is what we do typically is we are measuring waist to hip ratio. You are basically measuring your waist and your hips and you divide that, the numbers. And if you had so for women should be below 0.8 and below 0.9, ideally for a man. So, or you can just go in front of a mirror and you jiggle a bit. If your belly is jiggling, then you probably have insulin resistance. Is the fastest way of determining it. But basically, yes, what's happening, and not just in polycystic ovarian syndrome, which is basically when we really get a deeper look at it, you see it's basically a problem, a lot of times of nutritional status, how you are feeding in a way your body, you're basically eating too much of carbs, too much of processed food, processed sugar. So the things that are really peaking your insulin levels. And then, of course, toxicity is a huge thing. We all know what's happening with the toxins in the body and how the body tries to prevent the toxicity, kind of trying to put the toxins away to the safe place and stores it into the body fat, especially belly fat. So belly fat is something that is really important, but not with all ethnicities, like especially in Asian population, what we can get there, like comparing to an old Caucasian male with a big belly and big stomach, Asians don't. So it's not so much about being in a way overweight. It's more about how the body fat is actually distributed in the body. So not being so much overweight, because we can get some people who are not that much overweight, but they have all the signs of insulin resistance in the body. Also, the waist to hip ratio is significantly, over 0.8 or 0.9. And it's basically that you're over fat at certain parts of your body. Which is what's very important. And it comes down to polycystic ovaries again, where we have also progesterone issues, we have insulin resistance, and it can be solved with proper nutrition, clean diet, lifestyle, sleeping. So get enough rest, sleeping, detoxing your body, of course, always. So it's something that can be really good. I mean, you can get a grip of your polycystic ovaries just by nutrition, which is very, very amazing.
Absolutely. And we're going to get to that. And of course, we have pelvic inflammatory disease caused by a variety of different bacteria, such as chlamydia, gonorrhea, genital tract bacteria, and anaerobes. And of course, there's toxic shock as well, which I think Tina, you and I talked about that the other day about
I was just meaning to say, just to share what we were talking about the other day.
Because, okay, so toxic shock syndrome, remember when this was a big thing? Oh gosh, probably 30 years ago, right? Toxic shock syndrome. Every woman was getting toxic shock syndrome, everyone going to the hospital. And they kind of reminded me of when we did our glyphosate call, Clayton, that glyphosate, with toxic shock, kind of made sense because, well, they're spraying the cotton fields and tampons are made out of cotton, right? So
That's bingo.
That's what we talked about the other day.
And then you really get to the point where things just shut down, and I think that's the indicator, right? Is you look at the timing of women were getting toxic shock syndrome, but then it went away. Did it go away, or did the body burden get to a point where it said, well, now that's out of the equation. Now we're just going to go to total system failure. And that's the progression of issues, right? Where those little things that we think, oh yeah, this is a problem. And then we think in our mind, oh, well, we don't have that problem anymore. No, we don't have the problem. It's because everything has progressed past that point.
For example, primary ovarian insufficiency, or what they call premature ovarian failure, which typically occurs before age 40. And basically what's happening is the ovaries aren't producing normal amounts of hormone, the hormone estrogen, or being able to release the eggs regularly. And this also leads to infertility. And of course, this is caused by heavy metals, solvents, pesticides, the plastics, industrial chemicals. And these are all things that can disrupt ovarian function. And of course, there is a pathophysiological role for vitamin D depletion in ovulatory disturbances, and of course, and also with PCOS as well.
One study that I recently looked at showed that women who had higher pesticide exposure and glyphosate exposure had almost 40% higher infertility rate than women who had lower exposure rates. So, which is very, 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 very important.
Well, I think the really difficult part is we do so much to segregate, you know, different aspects, especially when it comes to our health, is people want to separate, oh, well, there's glyphosate, and then you have other pesticide exposure, and then there's heavy metals, and then you have, you know, as Dory was mentioning, PCBs and PBDEs and other fire retardants and other chemicals. And really, especially when it comes to the hormone conversation, which we're probably going to hit on more in a minute, because somebody doesn't get to see this stuff before, that heavy metals and a lot of glyphosate, they're hormone mimetic, you know, so they're not only blocking binding sites, but as those binding sites are then blocked when they're in their bloodstream, along with the natural production of the hormones, it throws everything off, throws everything out of balance, right? And what have we learned, you know, from Dr. Rao is that we're not like a teeter-totter. It is that mobile, and those little tweaks and little adjustments begin to have, you know, significant influence in different areas of the body. So knowing that everything is connected, you can't look at one thing individually and say, okay, this affects this area of the body, and it only does that. Everything is interconnected, and it just creates chaos as things begin to accumulate.
Absolutely. And the problem with toxins and all this, all the toxins you mentioned, is how they're actually binding to the receptor sites. They are actually kind of, you know, they're blocking them. I mean, when a hormone, a natural hormone it binds and then it releases, it goes off. And what happens with the toxins is that they remain attached to the binding sites, and they're constantly firing and triggering the body, which is also causing a lot of other reactions and disaster, and kind of a vicious cycle that is self-perpetuated and is going on, and it's not natural to the body. This is what's very important, and this is why you have to clean your diet, clean your life, clean your body, clean your slate, right? Clayton, so to if you wanna solve your infertility issue.
So that leads us to autoimmune and fertility. And there's a couple ones I want to talk about. So the first one is lupus. Women with lupus are more likely to experience pregnancy-related complications, including miscarriage, low birth weight, preeclampsia. 1/3 of women with lupus deliver babies preterm. And then there's also another condition called Anti-Anti-Phospholipid Syndrome. And this is also an autoimmune disorder. It can either be primary or secondary. And when it's secondary, this has to do with lupus as well. So lupus is primary. This condition here can be secondary. And what this does is it can cause pregnancy complications, including preeclampsia, thrombosis, autoimmune thrombocytopenia, fetal growth restriction, and fetal loss. And then we have rheumatoid arthritis. This is another chronic form of arthritis. So women with this type of autoimmune disorder can also lead to fertility problems during pregnancy, and also birth defects of the fetus and preterm delivery. And then we have scleroderma is another type of autoimmune disorder. Women that have this condition, sometimes, you know, during pregnancy, they're at risk for developing preeclampsia, preterm labor, and other kidney problems.
Yeah, especially all autoimmune diseases are a lot of times they are hidden. Like you don't know, like your thyroid levels could be normal. But what happens if you do a thorough investigation of miscarriages or infertility, what you can see then is sometimes you have just the elevated autoantibodies against thyroid. Hashimoto's is one typical presentation, and a lot of times is seen in pregnancy, especially in the setting of infertility and when infertility is being diagnosed. So, and a lot of times what we see even with, let's say, women who are not just coming to visit us for infertility, but especially maybe chronic fatigue and other things, is that even with just elevated antibodies, helping the thyroid and giving some hormones is, of course, bioidentical, is helping to, feel better and helps with fertility, because thyroid is so important. I mean, I don't know if there is like any process in the body that thyroid isn't involved somehow. And a lot of times what I see is when we get the first presentation of in pregnancy of gallstones in pregnancy, the first thing we need to think about and should be thought about in the first place is about thyroid, because thyroid has a lot to do with gallbladder motility. And if we don't have enough hormones, enough thyroid hormones, what happens is we have the gallbladder isn't kind of pumping enough of, and it's not working as it should. So we have the stasis there, and it's then this is the prerequisite for developing gallstones. So this is one of the most important things to think of when it comes to also to infertility. Basically, any sort of autoimmune diseases, and the screening should be done if there are problems with fertility.
Well, and one of the big things to understand with mercury toxicity is it's different between sexes, and this you can equate to autism. You can see it, but this conversation for women is the alternative. In boys or in men, mercury has the highest rate of effect on the brain and central nervous system. On women, it's the endocrine and reproductive system. So mercury has a tendency to go to the thyroid and the reproductive system more heavily in girls, which is why you see the hormonal issues, you see reproductive issues, and you see thyroid issues, where in boys, you see early developmental issues with the mental capacity and the other symptomology that comes with that, the autism, the Asperger's, the ADD, the ADHD. You don't see that as commonly in girls because those metals are congregating into another area. And if you look and you understand the mechanisms of mercury and how evil it is, it only makes sense that the areas of the woman that it would destroy first would be reproductive, because it's that bad. And then it's hormone disruptive, and then you can add in lead and arsenic and cadmium and aluminum and everything else down the list, and how bad mercury is to actually compound the effects of those other metals. So it's really important to understand, the difference between male and female, and why, the fertility issues are so prominent now because of the buildup of mercury, but also looking at male fertility, how there is a difference.
During pregnancy also, that the thyroid actually goes through some pretty significant changes, like a two to three-fold increase. I mean, it does so much for the body during pregnancy. And one thing I thought was really interesting, that thyroid disorders in men can also affect a couple's fertility. Dysregulation thyroid function can damage sperm quality and motility, making it difficult for sperm to enter the egg for implantation. Dr. Tina's most favorite subjects is gut health. So I'll just let you take it away.
So basically, yes, everything starts with the gut. Even Hippocrates said, if when in doubt, treat the gut. Like, this is where it all starts. Just one thing, that there would be only one thing that I wouldn't address gut first, would be in adrenal kind of fatigue, because adrenal fatigue is so important to take care of first, and it also is connected with infertility, of course, and the increased cortisol levels and what's happening with it. But gut is very important. Like, there's so many research out there that even when you are craving sweet food, when you're having your sweet tooth, there is research research that is showing that your gut bacteria and your gut microbiota is actually to blame because of the different, because you're having gut dysbiosis. And what happens, you know, when the bad bacteria are overgrowing and taking control of your gut, and then kind of regulating everything that is going on in your body. And another thing is, of course, leaky gut. I know you were addressing this on your calls a lot, but leaky gut is very important. Like gut cellular lining is one of the most important kind of protective
barrier
and shields we are having in our body, because it determines what is excreted, what gets to be absorbed, and what is actually what's remaining in the body and what's not. But especially when it happens that when this protective area is disrupted, what happens is that that bacteria, so bacteria, viruses, toxins, are actually coming into contact with the immune system, which is lying right beneath, with the cells of the immune system, which are lying right beneath this protective shield of cells, of gut cells. And they are not supposed to interact with the immune system that is there. So, and a lot of times what is seen in traditional setting is whenever we are having like autoimmune diseases or so any allergies, whatever is going on in the body, they are just treating and attacking the symptoms and attacking the immune system as if the immune system is overreactive. But in that case, if you're thinking the immune system is just doing the only right thing, and the only thing the immune system does is actually trying to protect the body. Because if the immune system is detecting I don't know, a bacteria or a virus or a toxin where it isn't supposed to be, of course it will react, of course it will produce antibodies. But those antibodies are very tricky. They are causing food sensitivities, that's one thing. And the other thing is that those antibodies are not just working in the gut or in the skin, as in the case of eczema, but they're also attacking your brain, they're also attacking other parts of your body. So again, you're having this systemic reaction, and everything starts with the gut. So whatever things you have, so many things listed out here, they are all interconnected. And when it comes to autoimmunity, when it comes to I don't know, other types of, let's say, even with adrenal fatigue, there are also gut problems. There is only one thing now in advanced functional neurodevelopmental neurology where they are actually, nowadays, now some people are actually saying the only one thing that is more important than the gut is actually the being, our brain being out of sync. So the left and right hemisphere being out of sync. And in case of gut health and in case of autoimmunity, let's say, there might be something like a deficiency of right hemisphere, which is then allowing the left hemisphere of the brain to take over. And the left hemisphere and the left brain is very into detail, into into kind of being focused to small details, and this is kind of triggering our immune system and gut to be very, very focused to what's going on and focused to react even more. So this is now really something that is really new and just emerging and evolving. And I think it's very interesting that there might be a next level to gut health as well. But I love gut health, and whatever you need, you do whatever, because your nutritional level, let's say if you're having a lot of, in case of this is a true story, there was one patient who had several miscarriages, and she wasn't, her insulin resistance was normal, so she didn't have any signs of insulin resistance. She wasn't overweight, so something was going on. And when we did her nutritional status, what we saw was she was low in B12, and she was also supplementing B12. She was eating like really a lot of organic food. So she was trying to live a healthy life. So what was going on? Then when we did another assessment, what we saw is actually she had gluten sensitivities. She had, and then again, no, she had celiac disease. She was having celiac disease, and this is also gut related issue in a way, and it is an autoimmune issue in a way also. So it's everything is connected with the gut, and we have to, and even low nutritional status, nutritional levels, if this chronic inflammation is happening in the body, of course the body isn't ready to sustain the pregnancy, because it's impossible for the body to sustain the pregnancy even if there is just no signs of autoimmune disease, but we already have autobodies. If we have gut dysbiosis, of course it's not, the body is just trying to protect the pregnancy in that way, saying no, so we're not ready yet, here's something, and this is an alarm. So having a lot of miscarriages or infertility is actually an alarm, as an eczema is an alarm. So the body trying to signal to everyone, especially to the doctors, hey, here's something wrong, take a look in that direction, because here's something that's missing, and you have to fix this before there are not optimal optimal conditions for this pregnancy to develop and to be sustained.
First, we look at gut health. Tina, could you correlate, or based on your experience, that if you have someone that has a bad gut, so the celiac aspect is glyphosate. We'll probably get into that a little more, yeah. But you could theoretically assume that damage to the gut lining would also be a correlating factor to damage to the uterus lining. So if someone has a damaged gut, that their likely scenario of having a high level of fertility is going to be correlated to that, because you have the similar mucosal membranes in both. So if you've got damage in one area, because we know the heavy metals have a tendency to damage more of the reproductive system anyway, as we previously discussed, then it's giving you an indicator. If you can't take care of this, your body's not going to be able to take care of the other one.
Well, okay, but you're getting ahead of me now.
Well, this is what happens when you don't give me stuff. Okay. The second part, I really equate to like the neurotransmission aspect, right? Because of the importance of the gut, and it'll lead me to my questions later on. I'll make my notes and shut up and continue, because I'll let the girls talk. But yeah, proceed.
Well, anyways, I just wanted, because you can talk on the next slide, okay. Because on the gut health, I just wanted to talk about the microbiome starts as early, in birth, right? So babies are exposed to maternal flora as they, go through the vaginal canal during delivery. Did you want to touch on that a little bit?
So absolutely, and not just during the delivery, even before. So there are so many. We know that there are toxins found in the cord blood of the newborn babies. And of course, those are chemicals that are disrupting the gut microbiota, causing dysbiosis, causing leaky gut. So in that sense, we are already, so the newborns today are born with the leaky gut syndrome, and that's why we're having so many eczema and so many other things starting very early on. And speaking of that, of dysbiosis and microbiota, of course, the primary thing is ideally with vaginal delivery, the vaginal bacteria that are in the birth canal are actually ingested during the delivery. The newborn ingests those bacteria, and those are then the first bacteria that are starting the microbiome of this baby, of this newborn. And this is how everything is connected, not just the uteral wall and the uteral lining, but also the whole birth canal and vaginal flora. It's actually, it's all connected again. And it is important that we are having the best bacteria there that are the most beneficial. And if you have, of course, disrupted gut health, then you have, of course, a dysbiosis also in the canal. And this is why all the bad bacteria in a way, or a dysbiosis, is already kind of ingested by the newborn and then causing a lot of problems, because this is the main gut flora that is then being developed in this developing gut. And this is a very important thing. So we're having multiple aspects and factors that are involved. So even
and it doesn't just stop there, because it continues on even, like especially for breastfeeding, right? Because with the breast milk, this actually promotes colonization and maturation for the baby's gut microbiome. So it's really important that when that you're breastfeeding as well.
But here's one of the connection factors then. So if you're saying that babies are born with gut dysbiosis and issues caused from the toxins, and you're saying adults have celiac disease because of their concerns with wheat and gluten, how can you have the correlation? It leads me to believe, because I've only done a little bit of research on this, that could it be that celiac and gut issues are not caused by wheat, but by the glyphosate, and the glyphosate is also in the womb that is damaging the development of the baby. So maybe we can just get rid of the titles and just say they're polluted and we got to fix it.
Oh yeah, but that's coming later.
Oh, God bless it.
All that's being covered.
Being polluted is just, it's one way, but we always have to take the holistic approach, which you said at the beginning, Clayton. So we have to take a look and be open for other things as well.
Well, and I think the big part, at least for my limited experience, is being able to, as you're correct, and the multidisciplinary approach is that from a study standpoint, is you haven't studied one area. You've got the Eastern philosophy, the acupuncture, the Chinese med, the traditional, the essential oils, the good nutrition, the detox side, and it's so important for people to understand this. And the important part is to be holistic. And I think that's the really big part of understanding. That's our approach too, is it's not just, oh, we're going to talk about this little subject. It's really systemic.
We've already kind of touched on this a little bit. I think, there's a strong indication that vaginal and endometrial microbiomes are associated with female reproductive health. And we know that dysbiosis is also associated with endometriosis, although it is yet unclear whether dysbiosis causes endometriosis or endometriosis induces dysbiosis, because there was a study done in November 2019 really linked to vaginal endometrial microbiome. Then moving on, this was pretty interesting here, IVF and gut health. Female reproductive microbiome alterations have been associated with different IVF outcomes. And you can just basically see here that, you had better IVF outcomes if you had this, lactobacillus dominant microbiota.
Yeah, and this is what we are coming to one of my other favorite topics, which are probiotics, because what I see lately is people are using different probiotics for just for everything, and you need to know what's going on in the microbiota to, I would say, supplement the right probiotic. And we see here lactobacillus is one of the ones that is missing in case of if there is if someone has a lot of miscarriages and infertility, but if or a better outcome in case of IVF if we have a lot of lactobacillus. So even with probiotics, we need to know what to substitute, which probiotics to use for certain things, because in maybe in let's say in eczema, we would talk about rhamnosus, and especially rhamnosus is very important to take during the pregnancy. So if someone is struggling with infertility and and then going through changing the lifestyle, the diet, and kind of cleaning the body and really we have to first, what we need to do is we need to, in case of infertility, what we need to do, and if we want to get a better IVF outcome, or if we just want to want to succeed with natural pregnancy is that we need to create an environment in which the probiotics and microbiota, that this good microbiota will flourish. And it's crucial that you are cleaning your diet, sleeping enough, taking care of your, as we said, gut health, checking your, checking for any autoimmune diseases that could be in the background, eliminating toxins, having, organic foods, eating organic foods. These are the things that, and supporting the liver, of course. Supporting the liver is one of the most important things to one of the most important organs that is also included in all of this. So it's important also which probiotics we would use. And not just take just anyone and take, let's say, LGG, and then in case of infertility, it wouldn't do you a lot of, it wouldn't harm, but it's not doing the job. And of course, we have to take care of our bodies and healing the gut so that this microbiota will be able to survive. This is one of the crucial moments.
So, Dory, I don't know if I'm going to get ahead of myself, but let me throw a question. So, because there's our little orange sachet of love, as it's been outlined by Teresa Mock, if say you have the ability to bind glyphosate, bind heavy metals systemically, so you can detoxify the gut more effectively than anything's been on the market, then you have a product that helps to stave off inflammation, helps provide some of the nutrients or compounds or superfoods that are known to create those tight junctions in the gut again, to help the restoration of your gut, almost like it was strategically designed for that. Then you also have the ability to expand and reactivate the production of neurotransmission, for dopamine, serotonin, at the same time also providing some compounds that are very important for gut regeneration. So if you're hitting on all those, and there's some prebiotic benefits to the little orange, our orange friend in the sachet. When it comes to the probiotic perspective, do you believe that through diet, through the good fermented foods, whether it's kefir, the krauts, the kimchis, the other fermented foods, pickles and such, that one could put more of a focus in those areas to improve the microbiome of their gut once the rest is done? Because we have the Trinity for that, that you can do it more naturally. Because what I've seen personally is my body demands it. But your thoughts, because there's so much marketing done in probiotics now that spend money on this one or these two or these three, where we're dealing with a vast array of these probiotics. So focusing on 1, 2, 3, 5, 7 is insufficient. It's great for marketing, but it's not something that we've done throughout history. When you look at ancient cultures, as you've done, you look at the Chinese, you look at Asians, for all of their fermented foods. The Koreans are phenomenal with kimchi. I love kimchi, by the way. And fermented bean paste, another one of my favorites. And then you look towards Germany with sauerkraut and other fermented foods that have gone throughout the region, and kefirs and such. So is there more benefit on cleaning up the mess, restoring the mess, and then letting your diet dictate what you need?
It's an interesting question. If you are truly, I would say, if you're cleaning up the mess and truly restoring, it might well happen that your microbiota it will change, because it changes when you're changing your diet, when you're changing your lifestyle. It is proven. We have research that it changes. But sometimes I would say certain bodies are, and in general, yes, I would say it is possible. And just focusing, I hope this person isn't having any histamine problems, and we're using so much kimchi and sauerkraut and other things. But yes, absolutely focus on that, and it would probably restore the microbiota. But I would say but I did have some cases where we were trying to do it all the way, as you just said. And until we started also kind of, giving the probiotic that according to the research, let's say, was missing, and even testing the feces and to see what kind of dysbiosis we are having, and then supplementing directly and changing and giving and adding a probiotic that was specific for this person that was needed in case of specific microbiota and dysbiosis, then at the end we got the result. So both cases are true. It depends on how severe, I would say, your gut is damaged, or how severe your whole body is damaged because of.
So it leads to the question. It leads to the question of people that are focusing on prebiotics and probiotics.
I would let prebiotics. I'm a big fan of natural prebiotics. So eating a lot of, let's say, what I'm saying is that both is possible. It depends on the, I would say, on the severity of, let's say, of the inflammation going on in the body, how many body systems are involved. So it may well be what Clayton was saying, that just by changing the diet, cleaning the body, supporting and supplementing the body with all the nutrients needed, antioxidants, and so on and so forth. And of course, eating a lot of fermented foods can restore the microbiota. And also, yes, adding some fats, let's say omegas, eating a lot of omega-3s, and having this, a lot of good fats in the diet will help to restore your gut microbiota. But it depends on the severity of and the complexity of how much devastation, the inflammation and the disease, and how many diseases actually you're having at the same time going on in your body. Because sometimes we weren't effective just by doing that. We needed to take a look at the stool sample test and see what kind of dysbiosis are we having, what's going on, and then supplement and substitute with the probiotics accordingly, with the ones that were specifically needed in this person. I'm not a big fan of just everyone just randomly now buying probiotics, and also there is a lot of probiotics out there, and of course they always need to be third-party tested to see if there is, because it's one thing to create a probiotic, but then this probiotic needs to be stable. It needs to be, when you are taking the probiotic, it needs to be alive. This is a live thing. So this is a very important thing to know and to see the results of certain tests. I'm not a fan of just taking now everything randomly, and just because someone is now recommending one thing and another thing, because this can also create a lot of stress in the body, as we are seeing right now, that people are eating and substituting with tons of supplements. Like they're having, like, I don't know how many, 20 pills of supplements in the morning, and after lunch and at night. And this is also causing a stress to the body. And I'm imagining, if you are just, changing one pill for another, there is no magic pill. There is a change of lifestyle. You have to have a knowledge of and understanding what's going on in the body to really go towards the root cause and eliminate the root cause. Because the idea is that you don't need to take so many supplements. The idea is to restore the function of your body so that your body can regenerate. And if we have to, sometimes, yes, in the process, maybe supplement certain things, but my idea is always to go away from tons of supplements, because it's just then I'm just taking one drug away and I'm just supplementing with 20 or 30 supplements. I don't think that is healthy in a way. It's a burden for the body, it's a burden for the gut, so, and for the stomach, not to mention. So yes, the idea is of gradually going and attacking the root cause, eliminating it, and restore the natural healing properties of the body. And if we have to do on the way, if we have to supplement specific things to just support the body until the negative inflammation is gone, until the body is kind of restoring its own function, of course we get to supplement, we get to give the body certain probiotics. But after a short while, things should be in the equilibrium, things should be balanced. And this is what I'm always aiming for. So I hope I answered your question, Clayton.
So here's the question to your response that was popping off, but the diet and choices. There are 257,000 different diet plans out there today. You can go keto, you can go vegan, you can do all of these things. People want to talk about changing their diet, doing all these different things. Would you agree in a statement that a toxic system is going to demand different things that might be different than what is ideal? And prior to making dietary changes or making adjustments to your lifestyle, that it would be more important to clean things up to allow your body to begin to find homeostasis. And in finding homeostasis, as you were mentioning, removing the glyphosate, removing the metals, allowing your gut to come back into balance, that once that process is done, you are going to be better connected, brain and gut. Vagus nerve is going to start connecting. Pineal gland should be decalcified. Neurotransmitters are going to start functioning again. And through that process, that you internally can start communicating better with yourself as to what diet you actually need and desire, because then you start consuming based on need and not based on hype, not based on what you've heard, but your body dictates what goes here, what goes there. I need these things. I want more salty foods because this is what happens for me. I don't eat sugar. I love salt. I crave trace minerals and salt. I don't touch sugar. I have no desire for it, but I love the fermented foods. My body loves that stuff. The sugary stuff I get is pineapple because I'm an O. But would you agree that as you bring the toxicity, the other issues in balance, the diet, the lifestyle stuff that is such great conversation points should and will take place naturally because of finding balance?
It will. I think it will, and it will change, of course, because your gut microbiota will change if you are cleaning the body. When you're cleaning the body, you're cleaning a lot of negative stuff that is influencing the brain, that is influencing the desire what to eat and when to stop eating. A lot of times we have that problem because even in the stomach, we have certain good bacteria that needs to be there. If they're not communicating with the brain, what happens is that there are a lot of people who just don't know where to, they don't have the feeling of satiety. They just eat and eat and eat. And when you're changing that would change as well. But I would say a lot of times, and I'm a big fan of doing this transformation because alongside, so not that, because the right diet is the diet that is designed for you. I was vegetarian, I was vegan because of trying to help myself,
What's your blood type?
A.
Yeah, you're made for it.
Yeah, but listen to that. It wasn't helping me. I wasn't feeling better. My problem was I had SIBO issues. I had low stomach acid issues, low B12 vitamin. I couldn't digest foods properly, especially protein properly. But and my mood swings were like all my hormones were out of whack, it was just crazy. But when I was then studying traditional Chinese medicine, I saw, because I was kind of, if you are looking through the blood type, I would be more vegetarian and maybe some chicken, and this is what I was eating as a child. So a good way to start is, what did you like? What foods did you like when you were a child before people started programming you, before your parents started programming you what you need to eat? So, and basically now I'm eating all the things. I added some meats. I added chicken, again, a lot of fish, and I love salmon. And my health really increased, and my health is restored. But also what I'm doing, I'm cleaning my body, I'm detoxing, I'm supporting my body the way I can to so that my body can remain in equilibrium. So it will change. It absolutely will change. But again, you have to be consistent even with that. You know, it's not just that you're going to take maybe one, I don't know, some detoxification agent once in a while and this will change. It needs you to change. It needs your lifestyle to change. It needs you to be consistent with doing those things. So I think it's a bit of both. But if you are consistent in doing that, of course, your desires will change, and what you will desire to eat will change, of course. But I see so many people just trying to do the detox first and support the body first, but still until they are, and if you're trying to detox and just remaining on the processed food diet and a high carbs diet, low diet without any fruits and veggies. And I agree with you. I'm like, pineapple is too sweet for me. I'm not eating any sugar. So, and I think it's very important that we give the body what it needs to increase the energy production. It needs to really activate our mitochondria to have enough of trace minerals, to have enough of magnesium, calcium, fats, iron. So we need all of that to, and yes, I mentioned fats, to activate our mitochondria, to activate the inner production of energy, which mitochondria is actually a place where cells are producing the energy. So when you need to, why is someone craving sugar? There's so many things. One is because they're so low on energy and they are trying to, so the body is kind of trying to increase the energy level. So there is demanding high sugar to actually to feel that the energy is there, because it's so low on energy. And another thing is that kind of body is usually, it's, again, everything's connected with insulin resistance, with body fat, with amount of body fat. So, and a lot of times when people are lacking sleep, are lacking good rest, is what happens is that the body is trying to increase the levels of energy, and it demands also sugar. It happens to, of course, if we are having like this fungal overgrowth in the body, like, then of course the body will demand sugar. It's not your body, it's your fungal overgrowth, candida.
Candida. Yeah, exactly.
So it's a lot of things. And because I've seen some people who succeeded in that way, and there will be no doubt a change in the microbiome, in the way the body will perceive certain things, in the cravings. But sometimes, until you actually support the body with the I wouldn't say just the diet, it's a healthy way of living, to increase the good fats, to increase omegas, to actually to increase food like non-starchy foods and vegetables, like 80% of your plate, whether, you know, it should be colorful veggies and what a lot of people are doing is they're eating the full plate of rice and then a small salad aside. But how it should have been is actually 80% of your plate should be a good colorful preferably leafy vegetables with some good protein source, good fats, so seeds and nuts and avocados, things like that. And in that case, then you will support your body with the proper nutrients also to be able to create the energy. And when this is changing, then also the sugar cravings will go down. So it's a little bit of both again, I would say, Clayton.
Moving on to male infertility.
Now you can talk, Clayton.
Oh, yes.
Semen and sperm. A common cause of infertility in men is poor quality semen. Possible reasons for abnormal semen include lack of sperm or very low sperm count. Hormonal imbalances could be, the hypothalamus, the pituitary, the thyroid, adrenal glands, low testosterone, other hormonal problems could be underlying causes. And then, of course, celiac disease, which we talked about a little bit earlier and in other calls, is a condition that actually contributes to male infertility. So fertility can improve by adopting they say, like a gluten-free diet. But then again, what about the glyphosate issue that we have and celiac? That's the point I think you were trying to make, Clayton.
Yeah.
Well, and it all comes down to, instead of really myopically trying to look at issues, and the hard part is, especially here in the United States, I mean, that's our entire medical system is predicated on segmenting things and siloing things. So you think that one condition doesn't have any correlation to another condition, so they can diagnose one thing, they can prescribe for it. You go get another thing looked at, they prescribe for that, they give you something else. And then you look at the correlating factors between those two medications that you're on, which cause other symptomology, which there's another doctor that'll treat you for that. Where if you never address the etiology,
the bad thing is that they're not even talking to each other.
Well, yeah, and they don't want to talk to each other because
right hand is doing.
Yeah, well, and they don't even speak the same language, right? And that's the really important part. So when you look at these factors, and if you go back and you look at the glyphosate piece that you and I did, and you look at the interview I did with Dr. Don Huber, and as you mentioned, the rates of sperm motility and male sexual health decreasing by over 30%, and that cascades over the last 20 years, and it's not stopping. There comes a very, very interesting time here over the next generation or two. You tie in the celiac disease, the hormone imbalances. Okay, what's hormone mimetic? We got that. And it's important to look at, as Tina can probably hit on, the key in testosterone and estrogen, not just in females, but in men. And progesterone and the other hormones, all of that stuff is thrown out of whack by these heavy metals. And then you can look at testicular function, and you look at what was hit on there. A lot of it is environmental in nature, whether it's alcohol or smoking or metals and hemochromatosis, which is excess iron, which is actually a really interesting issue, because hemochromatosis is one that the traditional treatment is still medieval. It's bloodletting, and we have a cool little crystal that has the ability to modulate that. So if you're one, or someone with hemochromatosis, one of the coolest things you can do is have them try clean slate. They might use a higher dose than what you might traditionally feel is comfortable, because most people think 1, 2, or 3 drops is good. They're going to need 5 to 10. Don't tell them what it does for their iron levels. Just get feedback on it. And well, for ejaculation disorders, I mean, this gets into other fun stuff, because if the fluids aren't working properly, then things aren't going to shoot the way that they're supposed to. And
retrograde ejaculation is sometimes referred to as a dry orgasm, and it is one of the symptoms of male infertility. And what's actually happening is that when the semen that should be ejaculated through the urethra is actually redirected to the bladder. So there's the sphincter there that contracts before sealing the bladder, and also inhibiting the release of urine, which prevents this reflux of the seminal fluids into the bladder during ejaculation. So that's another issue.
So Tina, with that, to get your opinion on that a little bit, and end that process, how damaging can that be?
It is very damaging because it's actually disrupting the mucus and the membranes and all the cells that are actually responsible for not just for the semen production, but also for being having a retrograde ejaculation. It's very interesting from the standpoint of the TCM, because it's kind of the energy levels and the chi, the direction of the chi should be downwards or should be outwards, and now it's actually turned inwards. So it's disrupting all the other streams of energy that are connected there, not just the physical damage that we're having because of certain it would be the same as if we would if you couldn't urinate and would just retrogradely urinate into your bladder. It's not normal, and it is actually it's causing it's a disruption, it's causing an irritation. So there's again multiple aspects to it, but the interesting thing is, why is it happening? Why this and I think traditional Chinese medicine is very good in explaining this, why this this energy change and the energy direction, the chi direction is changing, and what we can do to change. And a lot of things, as you said, is connected with the hormonal mimetics and why this is happening. So it has again multiple diverse actually consequences to the body, and not to mention the psychological effect. So having dry ejaculation and how and what kind of damaging effects this has. It's everything is again connected.
The theory always had been that if you're having sex before competition, it's actually going to decrease your testosterone levels. It's going to inhibit performance, when later research showed that it's actually inverse. That you're actually boosting your performance and your output. And so it's an interesting, and there's so much we get to continually understand, but of playing that.
It's an energy release. Like, just take it without like any scientific knowledge. What is it? It's an energy release. And some people are actually, whenever they are having any, let's say, emotional problems, whenever they are overthinking, whenever they're having any sort of problem they aren't able to solve, and they're going into the phase of overthinking, primarily what happens is this energy is kind of building up in the organism. And one way to release this energy and to get your body again into the equilibrium, because you're having like this there is this charge of energy that is created inside of you, and your thoughts are having a charge to them, and they are causing different electric streams and other chemical reactions, and it all comes to energy and vibration. And so there is a buildup of energy that needs to be released, and in that sense I think is in a way more of a restoration. So that's why it's very interesting with having any sort of erectile dysfunction or any sort of ejaculation problems, what is actually disrupting that, so that this energy isn't released in a proper way and outside. So and there is different, also when you're looking through traditional Chinese medicine, it is a good sex drive is a normal thing, and it is actually a release and restoring and rebalancing the energy. The only concerns, in a way, being really general, is, and I know you know what I mean, is the only concerns in a way Chinese people and traditional Chinese medicine has is actually having an orgasm during menstruation, because it's actually disrupting a lot of energy and energy levels. So in terms of female sex and orgasm, during the first days of menstruating cycle. There are some, it depends on different theories that you're looking, but this is what Chinese actually are talking about.
I'm just going to say that this slide we had on our EMF talk, but I just wanted to bring it up again that it does affect fertility, especially for men. And then, of course, we have lifestyle changes, which we've already talked a lot about, right? And then this is something really interesting, is the vitamins and fertility. So here we are. This is about vitamin D and erectile dysfunction, which we had on another talk. So vitamin D deficiency is very frequent for, especially with men with erectile dysfunction. It's also linked to infertility for women as well, and also with PCOS, which we also talked about, and lactation, endometriosis, uterine fibroids, abnormal sperm function, and reduced IVF success if you have low vitamin D levels.
Can I hit on the vitamin D component real quick?
Mm-hmm.
What does 0N have in it? 1,000 IUs of vitamin D plus the vitamin K that's needed as the synergist because of the curcumin and the pine bark. So, but we also know from Dr. Rao, from a benefit standpoint for how much he's taking, which was 10,000 IUs every other day, that 0N is going to be very, very supportive in that process. And it's the combination of factors, right? It's not just, okay, I need vitamin D, great. It's how you're sourcing it, what it's doing, but what it's combined with to be effective. And that's what's really crucial is and I think this is what Tina was alluding to as well, is so many people will look like, I take vitamin D, great. Just taking a supplement of vitamin D really is not going to get you very far, because you need some of the cofactors, but it's what it's combined with. And I think that's the absolutely crucial part of sourcing, but in combination, which is why Restore is so unique and why 0N is so special.
This slide we had on our vitamin D talk, I just wanted to show you this again, because what vitamin D has to do with in terms of like the placenta development, it's really important to have these levels of vitamin D in your system. And this is all leading back up to the gut health again. So we also need vitamin C. It's also known to improve sperm health as well as protect sperm DNA in men. It also helps to reduce free radical damage and improve ovarian function as well, and even helps to increase the level of progesterone in the body, which is directly related to improving the uterine health and thickening of the lining. And then zinc is also very important. It's actually the most abundant trace element in humans, but it can't be stored in the body. So it needs to be incorporated into your dietary intake. And it's essential for male fertility. It's actually considered as a nutrient marker with many potentials in prevention, diagnosis, and treatment in male fertility. It actually is for the formation of sperm, and a handful of studies have actually suggested that zinc deficiency might also lead to low sperm quality. So I put this order together with the vitamin C, the D, and the zinc as well. So maybe Tina, you want to talk about this slide here, just because it's all about, the tight junctions.
Yeah, exactly. So what we were talking about when I was explaining this protective shield of cells in the gut, you can see in this slide that there are tight junctions in the first image, which are really special connections with, and basically it's really what it is. It's a tight junction between the cell, and this is actually holding this barrier together. And vitamin D and vitamin C and zinc are very, very important to create and they are very important factors in synthesizing certain proteins that are actually constituting those tight junctions. And if we are lacking vitamin C, zinc, vitamin D, what happens is we get the compromised barrier, as we can get to see on the second image. And this is what I was talking about. Then viruses, bacteria, other food particles that are not being digested enough are coming through those where those tight junctions should be or supposed to be. They are coming through that because now the cells are not being tight together. They are in a way separated, as you can see. And in between the cells, now bacteria, viruses can come in between the cells, and they get into contact with the area below. And this area below this mucous membrane is actually bloodstream, but also elements of immune system. And this is how we are having the triggering reaction where the antibodies are being formed that are then attacking our body. And this is actually triggering our immune system. This is triggering, actually activating our immune system to be active and to start inflammation. Because whenever our body is trying to heal, whether this is having a tonsillitis, having a broken bone, whatever, pneumonia, a simple other viral infection, what happens in our body, if we are taking a look to the cellular level, is an inflammation in starting. So inflammation in a way is a way our bodies are trying to heal, our bodies are trying to restore whatever is wrong. The problematic thing is if our bodies are constantly under attack, are being constantly triggered, and then this vicious cycle of continuous inflammation is going on. And this is then the problem, is actually the immune system is doing what it's supposed to be doing, but it's just constantly under fire, it's constantly being triggered. And that is actually the problem. And we can see having enough of zinc, vitamin C, and vitamin D is a way to really restore or help to this integrity of the integrity of this mucous membrane to remain as it should be.
So you're actually talking about like in an acute phase, like say for example you break a bone, then you went to this chronic state of inflammation, which is triggering that whole NFKB response, that pathway that gets triggered from this chronic inflammation.
Yeah.
So here's another important vitamin, folic acid. It's found in many fruits and vegetables, but it's also used for, every woman that gets actually, there's a lot of studies that suggest that you should actually use, you should actually get these vitamins before you're thinking about getting pregnant, not just when you get pregnant, but you should actually, at least 6 months before, a year before, whatever, because this folic acid is important because of spina bifida, for the neural defects, neural tube development, I should say. Did you want to say anything about that?
No, it's very crucial that we start even before, when someone starts planning the pregnancy, so that the body gets well supported. Here with folic acid, we get to another thing, which is called methylation. I don't know if we have the time for.
That's really interesting, because I was reading something where they said you actually should take methylated folate.
Exactly.
Which is actually better, more bioavailable.
That is more bioavailable, and you because sometimes when you take you have to, because it's more bioavailable. Yeah, let's keep it short. Yes.
Yeah. Okay. And then of course we need with the folate, we actually need the B12, right? This is important for the folate metabolism. Okay. And then we need iodine, because what did we just talk about? We talked about the thyroid and how important that was, and the thyroid needs iodine. And then, of course, another important vitamin for conception and pregnancy and postpartum is iron. And anytime you take iron, you need vitamin C that needs to go together for the proper absorption. And then we also need vitamin A. This is really important for female reproduction function, as well as many embryonic events throughout the pregnancy. And so vitamin A is another important vitamin. And then we have coenzyme Q10, which I thought was really interesting. I love coenzyme Q10, but this is actually a pre-treatment with coenzyme Q10 actually improves ovarian response and embryo quality in low prognosis young women, for example, with decreased ovarian reserve. And that was on a study that I read. And then we have vitamin E, and low levels of vitamin E are often found in men with fertility problems as well. Also with women, vitamin E can actually increase the cervical mucus, making it easier for sperm to stay alive longer. So taking vitamin E supplements could increase a couple's chance of conception.
And here we are having, you can see from this image, a lot of good fats, healthy good fats, which are naturally working as anti-inflammatory. And again, we are back to the inflammation.
Mm-hmm. And the diet.
And the diet.
Because you can get a lot from your diet. Absolutely. Right? Food is the medicine.
Yes, it should be.
But we have to clean up first. That's the big thing. Got to clean up. And then, of course, then I like to look at like environmental factors, because we always come back to this, which we've already talked about. We talked about all of this stuff here. Heavy metals, again, we all know about it. Okay, and then we have air pollution as well. We have the glyphosate issue that we've already discussed on other talks. Again, if you have missed any of those talks, you can go onto the YouTube or the Root Brands channel. And then we have EMFs as well. We have endocrine disruptors. This is a big one. We talked about this before. All your PCBs, your PBBs, your BPAs, your DTTs, your DES, and all of these things. And also, you know, oxidative stress. It just, the list goes on. And maybe you want to touch on this, Clayton, because this is actually stored in the fat.
Well, it really goes back to what we were touching on, and as Tina went over in the beginning with insulin resistance and such, and fat, and understanding. If you want to understand the basis of why we get fat initially and why you have the belly fat, look at your internal organs and where everything is based around. And your protective mechanism is those metals are going through your circulatory system, so they're going through your bloodstream initially, and they're sequestered really quickly. And your body has to have means of eliminating them as fast as possible. So the first thing it's going to do is put them in visceral fat around your abdomen. And then if you see obese people, you know, it's really the hard part, right? Because there's, at least here in the United States, there's a stigma around people that are obese. And there's the assumption that they're lazy, they don't, you know, they're not taking care of themselves, where really it's a massive toxicity issue that started abdominally, and you know, there's just no room for the rest of the mess. And then, you know, they're in a massive inflammatory storm, and you start to clean things up. You get to see changes. But and I think that's the big part, right? Because the last thing that you see change, and Tina can probably speak to this, is if you're losing weight, right? If you're on a weight loss program, the last place you typically lose weight is around the abdomen, because it's that primary protective mechanism. Because if those toxins are released, then your body can go into absolute chaos, because it knows it's going to protect itself. So you have to have a mechanism to bind and remove those toxins, let alone just flush them back into your bloodstream through your, you know, through using your metabolism, whether it's through diet, whether it's through exercise. And this is why Restore, Zero In, and Clean Slate are going to be so unique from a weight loss perspective. Is Restore boosts your metabolism like crazy. I mean, it's quick. But then with the combination of Clean Slate and its mechanisms, you're going to, you know, likely, and we'll see this in people, you'll see a reduction in body fat because of the ability to improve metabolic function, but then also binding and removing not only what's in the fat, but what can be released from the fat.
And we circle back around to the beginning of everything.
Where it all starts.
Exactly. So
And
we're preloaded with all this.
And really, and this is really the key. And it's been such a cool cool time thus far, and with Dory's daughter and Tommy's. I'm not sure if Tommy's here, but some of our first root babies were actually in Scandinavia. But now seeing some in the United States and looking at the quality of pregnancies that women are having, and I've worked with a lot of women that were infertile, and started using Clean Slate and its predecessor, that within a couple months were able to get pregnant and had amazing pregnancies. But the babies, the development and advancement of these babies that are on Clean Slate is ridiculous. With their responses, their attentiveness, their alertness, eye contact, paying attention to things around them in a couple days. So clean babies are better babies.
Mm-hmm. Okay, well, and this is just a summary slide here. And now we come to the Trinity.
Tina, I'll throw this at you because you've been in practice, but also Dory. I mean, and the community hasn't been able to experience Restore yet. It's coming. And I will give you my position on this because of the genius that created this. They are designed as the Trinity for a reason, right? One is good, but together they do some stuff that there's never been protocols for. And this is, like I was going over on my Facebook Live the other day, it's what you have now in your hands in the Trinity pack, the health assurance plan that this combination of 3 products really is. And you guys have already seen it with Zero In and Clean Slate, but adding Restore into this approach, from a gut brain standpoint, there has never been a protocol, especially from one company, to put all of this together, but to have a protocol that hits on every major aspect of the gut brain connection: neurotransmission, detoxification, gut benefits, restoration of the gut. And there's one more thing that we're working on that'll come over time and that will fit with that. But you look at the conversations that people are having, oh, the gut brain connection. There is no one else that can actually hit on this the way that we can. I honestly think that Europe and Eastern Europe's less polluted. So you guys are more sensitive to really good things and they work better in people, right? So you will find probably in Europe and Eastern Europe that a quarter of a sachet, a half a sachet per day per person is going to be absolutely amazing. And you can tweak that. And I think it's really important because in a lot of our countries where we have influence, where the dollar costs a lot more, the local income ratios aren't as adept as they are here. You have something that can take care of a family, or it can take care of an individual for an extended period of time and get amazing outcomes. But like we were hitting on, the benefits of these 3 products serve as the foundation of getting well, that after you start using these 3 things, as Tina was hitting on, then you can start to rebuild and regenerate. It will naturally take place because of what these 3 do. Doing a bunch of stuff before, taking a bunch of supplements, taking a bunch of probiotics, taking a bunch of nootropics, whatever you want, is actually just a waste of money. So one of the things that you can tell people is like, look, if you're taking a bunch of supplements and you're spending a bunch of money on other stuff right now, stop. Don't waste your money. If you're taking a bunch of stuff, just hold on to it. Don't take it. Try these 3. And as Dory mentioned a couple of weeks ago, in 120 days, our body regenerates, right? It goes through the process of regeneration. So the challenge is great. Do this for 4 months. Do these 3 for 120 days and watch what happens. And then you can make the determination if it was worth it. Because what are we seeing? What are we talking about? What did we see last week, with these amazing experiences? They're all less than four months. All of them. Do you guys look at Paris and what she's done in 90 days from the journey that she's been on for 14 plus years as a practitioner focused in this space? And in 90 days of using, okay, let's see, 90 days, 180 drops. You get that? Not even a half a bottle. I'm pretty sure with the change in viscosity, it might be about a half a bottle. A half a bottle over 90 days, she's a completely different person. And you can see it spiritually, emotionally, physically. So if you follow these three over 120-day period, I guarantee you will see shifts in your life that you've never imagined before. And then everything else will start to come in line. The probiotic aspect, your body, your cravings will change. Your body will start to tell you what you need to do. It won't be forced. You won't have to try to punish yourself to make changes. You'll want to go for a walk. You'll want to be more active. You will see shifts. That's it. It's just a different approach. What do we talk about? Rethink everything you've heard, everything you've been taught. Because why do we get to do that? Well, and this is the cool part, because Dory saw her, but I'm not sure if Tina saw her when she was talking. Christina came in and she's like, let Tina know that I love her and she's amazing. But we have the most amazing group of scientists and doctors. And as Birgit and a couple people mentioned, we have the most amazing group of beautiful people with all of us collectively that are doing some stuff that's not been seen before. This is unique. This is different. And granted, you know what? We've got probably the leading nanobiotechnologist in the world that's the one who put this stuff together. And that's not an understatement. And understand that Harvard's actually stopped the nanotechnology bioscience engineering program because there's not enough students for it. There's not enough minds that can actually go through that. She crushed it. This is where you guys sit. You have in your hands probably the most powerful combination of products that's ever been put on the market at a time when it's needed more than any time in history.
Thank you, Clayton.
Great job, guys. So cheers all.
Talk to you later. Bye-bye. Thank you so much.
Thank you all. It was a great call.
All right. Thank you. Thank you, Alfred. Okay. Bye-bye, everyone.